Today we are in conversation with Dr. Vatsal Shah. He's a consultant pediatrician and neonatologist with special interest in critical care. He's a founder at We Care Women's and Children's Hospital in Ahmedabad, founded in 2014, and has various publications to his name. We cross-refer patients because we share the common ideology when it comes to pediatric wellness. You can't feed kids what you like just because they are young and have higher requirements. In this podcast, we are going to cover some frequently asked questions and lesser known facts about a child's health and fitness. These topics were carefully chosen based on our individual clinical experiences, and we thought it was the right time to create awareness, especially for parents. If you have any more questions regarding your child's health and nutrition, please post your queries in the comment section. Hi, Dr. Vatsal.
Hi Shwetha, how are you?
I'm very well, and thank you so much for taking out time for this podcast.
Thank you so much for having me here. It's an honor.
Let's get into our topics directly.
Right.
My first question is about overweight and obesity in young children.
Right.
I'm seeing in my practice that very young kids are coming in overweight. And I have alarmingly seen a very high A1C in young children as well.
Right.
And, often ask the parents about the pediatrician visits. So, it seems to be like after a certain age, they stop tracking growth.
Right.
What is your experience? At what age are you seeing overweight children come into the clinic?
So Shwetha, it is actually a burning question for today's era that because we are now switching to the developed countries,
right,
like Western countries, we are seeing much more patients. I'm talking about kids only, much more cases with obesity and overweight and mainly lifestyle related diseases,
right,
which includes the diabetes as well.
Right.
So I am seeing as young as 4 years, 5 years of kids with overweight and going for the obesity.
Right.
And I have to tell the parents, okay, your kid is above the line expected
for
or
weight.
Ideal weight for the age, and then I have to do it like much often nowadays. At least every day almost I have to tell one family,
right,
that, okay, your kid is overweight and you need to do something about it.
Right.
If you will not do that right now, then the kid will face problem in the future.
That's right.
So you say that, okay, you've seen A1C going high in young kids. Yes, that is quite possible. I've seen as young as 8 years, 9 years that are having metabolic issues and
right,
high HbA1c.
Right.
So it is very much alarming for
right,
today's generation.
So talking about type 1 diabetes, usually my approach is that, I like to keep the diet quite strict on most days because, kids, they anyways have exposure to junk foods in school,
Yes,
during parties, celebrations, when there are outings. So my, kind of way of working or method is to keep the diet strict at home as much as possible so that we don't have to push in extra insulin into their systems.
Right.
And then we have these days where we relax the diet and let them eat what they want. So they get the best of both, where they can celebrate also and still have a good A1C level and sugar control. What's your take on this?
So basically that is the most ideal approach,
right,
for any kids who's suffering from diabetes, type 1 diabetes. Unfortunately, there is no cure for diabetes as of now, so they have to take lifelong insulin.
Yes.
The sad part is whenever we tell parents about the diagnosis and the management, the acceptance is a big problem.
Right.
They don't accept the problem. They don't accept, okay, why my kid has diabetes? No, he cannot take insulin for lifelong. No, he cannot control diet for lifelong. So that acceptance is a big problem. And actually that also causes a lot of problem in upcoming follow-ups.
Right.
So once, suppose by any means acceptance have come, now it is the kid has diabetes, he's on insulin.
Yes.
So he is taking insulin every day, he's not eating chocolates and everything. The parents are feeling guilty.
Right.
Okay, we are eating everything, his cousin is eating everything, his
right,
sister is eating everything, why he's not eating? No, usko bhi de do. No, let him also have it. We will increase the insulin. So that guilt part also comes in later on.
Right.
And that also causes lot of problem. But we have to understand, parents have to understand that here only kid does not have diabetes. The whole family has diabetes. Once they understand this concept that everybody is a diabetic in the family, then they will win this battle.
Right.
Once they change the lifestyle of the whole family, then only they will, overcome the health issues pertaining to diabetes in the kids.
So I always believe that diabetes management is actually just eating healthy. And as much as it applies to the child, because we have to keep their sugars under control, as we cannot keep on increasing their insulin doses, it just makes sense that the whole family follows it, and there's better compliance then for the child also, because he feels like he's a part of the same system.
Yes.
And especially with older kids, as they go into adolescence, we've seen that there is insulin resistance related to their growth spurt. So already there are other factors which are making the sugar control worse. So it just makes more sense to keep this a little tight, so that the child ends up being more on the healthier side than on the sicker side.
Yes.
So I have seen a 4-year-old case with a high A1C, which again we're talking about type 2 and not type 1.
Yes.
And when we ask parents about tracking their growth, because they're going out of their channels for weight, for their age, and like you said, they're clueless because nobody's tracking the growth, and the child appears to be cute and chubby.
Yes.
So nobody's doing anything about it, right?
Yes.
Until we accidentally find out in blood reports that the markers are going up.
Yes. The most common question comes, sir, मेरे बच्चे का वजन नहीं बढ़ रहा है, and they want their child to be cute and chubby.
Right.
So instead of going for the balanced diet and healthy diet at home, they switch to, or they move towards the unhealthy habits.
Right.
And eventually, yes, kid becomes cute, chubby, and overweight as well.
And sick.
And at the end, he will definitely have problems. You need to consult your pediatrician. You need to plot chart on proper weight for the age,
right,
and see where your kid is going.
Right.
That is very important.
So talking about underweight issues in young children, sometimes parents, they get very anxious that my child is not gaining height or my child is not gaining weight, and then they try and get in all these measures to give them more food to increase their height and weight. So usually I think that it's not always a bad thing if your child is underweight. Like, there's no immediate requirement to just push in food if there are no red flags. So can you tell us a little bit about how to identify the red flags in underweight kids?
Yes. So the underweight does not mean the child is unhealthy.
Correct.
Being healthy is more important. If you see WHO guideline definition of being healthy, it clearly says that disease-free body is a sign of healthy body.
Right.
Weight is one of the indicators, definitely. But if your child is not falling sick repeatedly, he does not need hospitalization very often, he is growing excellently in academics, socially, emotionally,
yes,
and he is doing good in sports, then I would not worry about the weight alone where he is lagging behind. I will definitely advise parents to maintain the balanced diet, but don't go
overboard.
Only the weight part,
right,
and concentrate on overall health rather than only on weight part.
Right. So the height is more an important factor here.
Yes. So in that part, if the child is underweight on the chart, if the parents feel okay, he is not growing well, so I definitely show them what is the kid's height as per age, and invariably their height is very much accurate because height indicates the long-term nutrition part.
Okay.
So if the child is chronically malnourished, height will be less for his age.
Right.
But if the height is proper for his age, that means he is maintaining his nutrition pretty well.
Right.
So weight is for the acute part.
Right.
Height is for the chronic part.
indicator.
In those things, measuring height helps a lot.
And we also see that catch up also happens with these kids at some point. So they might not go as per the growth channels of the other kids, but then suddenly you see that during the growth spurt, their height and weight also kind of comes within range.
Yes.
Right?
So basically what happens many times, the parents are tall, so kid also is gonna get taller, so he will look skinny. They will think, okay, he is very patla, he is very thin, he is not healthy, but his weight is as per his age. He is falling into that category.
Right.
But he just looks skinny.
Right.
But he is not unhealthy.
Right.
So we have to keep that also in mind.
So basically, we need to rule out the nutritional and medical, causes of growth not happening on time. And once that is sorted, then of course we need to also look at exercise, because that's such an important factor for their skeletal development, and to make sure that they're not gaining fat, they're gaining their lean mass. And then, of course, if we feel like the child is falling short nutritionally or not eating enough, and like you said, the red flags, he's not able to study or not able to keep up with his energy, or immunity is a problem, then we can also consider supplements for kids who are not eating enough, under guidance, of course, right?
Yes, yes, of course.
So while we're on the topic of supplements, routinely when we have blood reports come in, we see common deficiencies of B12, vitamin D, and iron, because we do know that growing children require more iron. So what is your protocol in terms of iron? Like, how do you go about with supplementing iron and vitamin D in young kids?
Iron is basically, we Indians are basically iron deficiency people. So iron supplements is very frequently required in kids. Sometimes it requires in less than 1 year of age as well. And once they start going to school, and especially where the females are hitting adolescence,
Right.
when they are achieving their menstrual cycle, at that time they need iron supplementation.
Right.
Vitamin D deficiency is very common because obviously we live in concrete jungle.
Yes.
From AC to AC, we don't have enough sunlight exposure. So vitamin D supplementation is also required. And there are certain symptoms like back pain, growing pains, leg pains, frequent headaches.
Right.
Those are probably some subtle signs of vitamin D deficiency. Headache is a very common sign of iron deficiency as well. So if we take those symptoms, and depending upon that, we start iron and vitamin D supplementation as soon as possible.
So the protocols go similar to how adults take it? Like, how does it go? 1 month to 3 months? What is the general thing that you follow?
Iron requires 3 months course. The first month is mainly for the immediate recovery of the iron, and for the next 2 months is for the storing
and maintenance.
The maintenance. So for the 3 months as same as adults actually, and dosing is depending upon the weight.
Okay.
We give as per the kid's weight.
Okay.
And usually 3 to 6 milligram per kg per day. In 1 to 2 divided doses we give.
Okay.
And we give for 3 months.
And what kind of iron supplements do you use? Like, one which are gut friendly, or a general sulfate fumarate? What kind of?
See, there are few brands, there are few products, iron powders which are available. Nowadays, almost every company is trying to make it gut friendly. But it is definitely from the product to the child compatibility. Some kids are very okay with this product. Some of them have problem. So we change the brand once we see, okay, child is having problem. So we change the brand and we see again. Or we change the powder basically, not the brand, powder. So depending upon the kid and his symptoms and presentation, we give them the powder as required.
I have one question. One parent was telling me that if we give iron syrup, then their teeth will turn black. Is that correct?
Yes, that is one of the side effect, you can tell, that of iron supplementation, but it is a reversible side effect.
Okay.
If it happens, you just consult your pediatrician and you can change again the powder, and that will go away. If it persists, you might need to consult a pediatric dentist, but usually it's a reversible thing if you report it early, to your pediatrician.
So it's fine to give them the syrups?
Please, you have to give. You have to give iron.
And for me, vitamin D, I usually dose it as per the adults, because I've been seeing the guidelines are quite similar. And of course, I see the blood report first. Usually it's a part of the panel that I call for. And the main thing we're missing is omega-3, because it's deficient in the Indian diet. And as you know, a large part of the Indian population is vegetarian. So we're not getting it through our animal sources. And I routinely prescribe supplements, especially in this population of kids, because, the guidelines are at least we need 500 milligrams of omega-3 for kids 1 to 3 years of age. Then about 4 to 8 years of age, we need about, 700. And then for older kids, it's about 900 to 1200 milligrams. So this is through a combination of food and supplements. So I do an analysis through the diet to understand how much omega-3 they would be getting, and then it's always safer to give a supplement because it's an essential fatty acid, and we can't ignore how important it is for their growth, especially for their brain development.
Yes, for the brain part, omega-3 is one of the most untouched element, which nowadays, content, nutritionists, dietitians, you are, putting forward to the population that please, this is also important.
Correct.
Which we have been saying since ages. So yes, that is very important.